Together we achieve victory over heart failure.
Hello, everyone. Welcome to the podcast. And I am Dr. Rajni Sharma, Senior Intervention Cardiologist in Fortis Shalimar Bagh and also associated with Sanjeevan Hospital, Daryaganj. So, today I would be talking upon and clearing about certain facts and fiction regarding the heart failure situation that we are finding in general population nowadays very commonly, whosoever admit with heart ailment in hospitals. So I would be talking upon the misconceptions considered regarding heart failure in general population. So there is a myth that heart failure only targets the elder population who has more risk towards coronary artery disease or who have blockage of heart arteries. I would tell that it is not so, but the majority population is definitely comes from people who are generally more than 50 years or who have diabetes or hypertension and thyroid, etc., other risk factors. But definitely there is no age bar in making a diagnosis of heart failure, and it do affect the younger population also, where the etiology would be different, like those people would be having low pumping, that is considered as dilated cardiomyopathy, and those young generation can go for heart failure, as well as whosoever is getting thyroid problems at early age and valve disease where the valve function of the heart is not normal, even they can go for heart failure situation at a younger age. So that myth has to be taken out, like heart failure is age bound and that to elderly. So another myth is that only chest pain means a heart attack. So I would say any chest pain is not heart attack, or getting a heart attack is just not defined by only one symptom, that is chest pain. While considering any chest pain to be as heart attack, there has to be certain features which tells us that it is related to heart attack. Like the chest pain of heart is generally kind of constriction or rather congestion or discomfort in the center of the chest, but it is also felt along the shoulders and sometimes inner side of the left or right arm, either or sometimes both. It can go up to even lower jawline and below up to umbilicus, it can be felt. So we cannot say like pain felt in epigastric region or abdomen or some like acidity symptoms, that could not be heart attack. Sometimes when there is a right side artery block, so more so symptoms mimic as of a gastric symptoms. So we have to clarify all the symptoms whether they are falling into the heart etiology or not, along with the other investigations like cardiac biomarker and ECG. We clear out further the chest pain symptoms. So I would be elaborating on one more myth, like heart failure means that one person's heart has totally stopped. So I would clarify that it is not so. Heart failure means that it has not stopped totally, rather it is not able to pump properly in sufficient way so that it can provide efficiently to all organs blood properly, so that pumping capability of the heart is not sufficient enough to give enough of oxygen or blood to the vital organs especially, as well as other organs also. So we, if the blood supply is not proper, then the symptoms of breathlessness and swelling in the feet could be seen commonly in such patients. So heart is pumping, it is not stopped as myth is there, but definitely heart failure means the heart is not working efficiently enough to give proper oxygen and blood to the organs. So one more common myth is there, long term smoking can not lower risk of heart disease just by quitting smoking. So I would say the moment smokers quit smoking, definitely the positive benefit or the risk of getting heart disease starts getting down from then and there itself. But one person to have or consider as a non-smoker person when comparing to the general population, it may take 5 to 10 years. But definitely the moment person leaves smoking, the risk keep on decreasing, so much so that by leaving 1 year smoking, the person can reduce chances of getting heart disease by 50%. So quitting smoking gives beneficial effects from the moment person quits smoking. So one more myth is there, like people say I should not exercise after having a heart attack. So I would say when there is a fresh event or heart attack, that time definitely exercise is just not possible. But while patient is recovering from that, which could be started as early as after 72 hours of a heart attack, we start training person to or promote person to do exercise. Initially it may be lighter one, but as the person recovers from heart attack, the propensity of doing exercise is gradually increased, especially under, obviously it has to be under surveillance, and some physical guidance should be given. A physiotherapist should guide, like patients, considering patient pumping as well as heart rate and how many days has passed from that heart attack. Depending on these features, we gradually train heart again to live a normal life, or as much as near to normal life to all cardiac patients. That comes under cardiac rehabilitation program as well. So with proper care and treatment, individuals with heart failure can lead or fulfill lives like a normal person, navigating their conditions with resilience and determinations as well. So getting a heart failure, where most common cause to get heart failure is definitely coronary artery disease, that is blockage of arteries. But we do have other causes also which causes heart failure, but we have to consider the etiology and then symptoms of heart failure. There are very good medications which give and mortality benefit, that means which prolongs life and definitely increases pumping also, makes sure that pump function of heart is working better and better with these medications, along with physical training of that particular heart failure patient as well. So I hope this information has been very helpful for all the general public regarding the heart failure. Thank you for listening.